As the COVID-19 pandemic spread around the world, schools, shops, museums, restaurants, and businesses closed their doors. Even church buildings were forced to close. But not the church. The real church never closes doors. Crises remind us that the real church is not four walls and a roof. It's you and me and our fellow believers who continue to be the church outside our buildings, who seek to serve, bless, and minister to our communities, who say, "I will go." In the Philippines, the sudden closure of stores and other facilities, as well as the abrupt drop in tourism, caused low-income families to lose their jobs. They struggled to meet their basic needs, which included buying a staple food, rice.
As we know, from March 15, the Philippines is locked down, and we understand that the people in everywhere near the capital is having a difficult time, and they don't even have any rice and food at home. So we understand the situation, and we try to raise some funds to help them. For each family, we would provide 10 kg rice, so that will help them to go through the difficult time until the lockdown is over.
During the first distribution, over 1,200 families received rice and Adventist literature. The second batch of rice distribution was organized 4 days later for nearly 900 families. 400 sacks of rice were given out in total. Adventist literature was included because the team wanted to minister to the people's spiritual needs too. In China, Seventh-day Adventist leaders and members in many communities began doing whatever they could to be the hands and feet of Jesus. Adventists distributed food and supplies, including masks, sanitizers, gloves, non-perishable food items like rice, oil, and flour. They also provided meals for overworked medical care providers and government workers, and volunteered to sanitize public places like elevators, stairs, hallways, or markets. They cleaned homes, gave haircuts, and delivered fresh vegetables. In all, thousands of people were helped during the pandemic. In Madagascar, a group of women came together to sew hundreds of masks, which were distributed to help stop the spread of COVID-19. They also donated warm clothes to help families through winter. And every week, Adventists visited remote villages to provide hot meals to the less fortunate and vulnerable children. More than 400 children have benefited from this. In addition to sharing meals, the Women's Ministries Department has been able to broadcast workshops and special programs, including a week of prayer. The COVID-19 crisis changed everything for ADRA. The needs had never been greater, but lockdowns, travel restrictions, remote work, and every new uncertainty brought on by the pandemic required new ways of thinking and new ways to meet these unprecedented humanitarian challenges. ADRA quickly launched a COVID-19 task force with members from around the world so that the agency could address the reality of a global crisis with the power of a global response. In addition, they leaned on their partnership with the church and the worldwide church network to reach even more of our neighbors in need around the world. As the potential devastation of the pandemic first became evident, ADRA's Africa Regional Office partnered with Adventist Women's Ministries and youth departments in 16 countries with one goal: to ensure communities wouldn't go hungry during the crisis. ADRA's expertise and the church's resources came together to train women and young people to plant sustainable household and community gardens. In turn, these volunteers would train others in their communities, as well as provide seeds and gardening tools, and spread awareness about preventing COVID-19 and disaster risk reduction. In Uganda, people excitedly reported that they not only had enough food for their families, but also enough to share with their neighbors, as well as sell additional produce for income. The success of the project in Uganda prompted the church to donate 100,000 hectares of land to ADRA to launch an Adventist Learning and Livelihood Center, where together they can continue to serve many more people in coming years. In Zambia, youth taught local women how to minimize the effects of disasters on the local area. And the women, in turn, taught the youth how to prepare the nutritious food they'd grown together in community gardens. word continued to spread, and more people wanted to be included. The goal of training hundreds of people was quickly surpassed, and now thousands have food security. ADRA served close to 20 million people in 96 countries in the first year of the pandemic alone. And now they are working with communities on the next steps to recovery. All over the world, people are gaining awareness and access regarding the COVID-19 vaccines, as well as critical tools, training, and resources to feed their families and build sustainable livelihoods. When India and several neighboring countries in South Asia were hit by a massive surge in COVID-19 cases, ADRA partnered with Seventh-day Adventist medical facilities across the region. In addition to supplying personal protective equipment and other critical resources to hospitals and clinics, one overwhelming need was oxygen. ADRA provided oxygen supplies, including an oxygen generator plant, or OGP, to Metis Adventist Hospital. This OGP allowed the hospital to have its own sustainable source of oxygen for this crisis and beyond. ADRA is currently working on the delivery of 6 more OGPs for medical facilities in India.
Hello everyone, this is the oxygen generation plant which is sent by ADRA. We really want to thank ADRA for understanding our need of the hour. When the entire country was battling with the shortage of oxygen supply, we also at Metis Adventist Hospital had these difficulties, and we really want to thank ADRA. Thank you, ADRA.
Adventist education is also playing a key role in helping communities cope during the pandemic. In Puerto Rico, Adventists have created a space where everyone is welcome. CentroCEF is an urban center of influence that was started to help people prioritize community, education, and family. Before the pandemic, students and faculty from Antillean Adventist University offered programs that promoted healthy living. They met people's needs with activities such as health fairs, giving clothing to those who need it, and praying with people.
During the pandemic, the services needed to be adapted a little. But we continued by doing online workshops for parents and art workshops for the kids. We also created a WhatsApp group where we send daily educational videos.
This online shift allowed the volunteers to stay connected with people, even when they can't be together physically. They have developed an online group for women to interact and support each other.
It helped me a lot. Many times we need support and others won't listen. And in my case, I have been living completely alone for 3 years. It's not easy.
The COVID pandemic has revealed what it really means to be the church. We're thankful that worship continued online, in drive-in churches, and small groups. But we praise God that tens of thousands of Seventh-day Adventists have also left their church pews to engage in mission, to bless their communities, to share the good news. Yes, they've ministered to people's physical and emotional needs, but they've also brought hope, grace, and salvation. They've been the church during crisis. Jesus said that when He comes in glory, He will say to the righteous, "For I was hungry, and you gave me something to eat. I was thirsty, and you gave me something to drink. I was a stranger, and you invited me in. I needed clothes, and you clothed me. I was sick, and you looked after me. I was in prison, and you came to visit me." Truly, I tell you, whatever you did for one of the least of these brothers and sisters of mine, you did for me.